Hi, my name is Aaron. We're going to be doing case study number 1. The scenario is a 10-year-old Hispanic male is hospitalized post-appendectomy complicated by peritonitis. Surgery was yesterday. Pain is controlled well by IV pain medications. He is on IV therapy. He is expected to stay 3 more days. The IV has to be changed. He does not cooperate with coughing exercises and does not want to ambulate. The provider wants him up and walking the hallways. He is a 5th grader with no learning delays. He likes sports of any kind, and his mother is attentive and insists that he needs to be totally cared for in bed. So we're going to have Tiffany as the nurse, Diane will be the mother, and Gam will be the son.
Good morning.
Morning.
My name's Tiffany. I'm going to be your nurse today. How are you, Gam?
Good.
Good? How are you feeling?
Okay.
Okay. Do you have any kind of pain at all?
Yeah.
Yeah? Can you show me where?
In my stomach.
Oh, in your stomach area. Oh, I'm sorry to hear about that. Well, I hope that we're going to make you feel a little bit better, okay? I'm just going to go ahead and I'm just going to start to listen to your lungs, okay?
Okay.
Your lungs and your belly, okay? So you can just breathe normally for me. Now, how's your pain? Is it hurting you a lot today?
Yeah.
Yeah. And how about you, Mom? How are you doing?
Oh, I'm good. I'm just trying to make sure he's feeling okay. So I'm just kind of keeping him in bed, just making sure he's feeling okay.
Okay. Well, the provider had notified us we need to go ahead and change his IV.
Oh,
Uh-huh.
well, he's got one.
Yep, I know that he's already has one, but one of the things that we like to do to prevent infection is to change out the IV, because what could happen is we can get a blood infection known as septicemia, and that can have some serious complications. So I just want to take a look at his IV.
Is he going to be here for a little while longer, or I thought we were leaving soon?
Well, right now the doctor has said that he's going to probably end up staying for another 3 days.
Okay.
Yeah, so we want to just take a look at his IV side. So I'm just going to take a look right here. Can I see your arm again? So I'm just looking at the side and making sure that there's no redness, no tenderness, any kinds of infiltration, extravasation going on here at the IV site. Do you have any pain at all at the site?
No.
No? Okay. Well, we're going to go ahead and change out the IV. Okay. So I'm going to go ahead and change the IV and put on a new one.
Sure you want that?
Yeah.
You sure?
Yeah.
You were telling me you didn't want anybody touching him.
I know. And no one likes to get sick at all. No one really does. But for the best outcome possible, just to make sure that we avoid any kind of infection, we're going to go ahead and give you another IV. And I promise I'll be as gentle as I possibly can, okay?
Okay.
All right. So I'll go ahead and get you a new IV.
Okay.
All right. Oh, okay, great. We've got a new IV. You did such a great job, yeah.
Oh, that hurt.
Oh, it hurt. I'm sorry. I try to do as easy as possible as I can, okay?
Okay.
Now, what about your coughing? Has he been doing any kind of deep breathing, any kind of coughing?
No.
No? Can you tell me why?
Because
Do you not know how, or are you having trouble?
it hurts.
Oh, it hurts. Well, you know, one of the things that we can do to help with the coughing is what we call splinting. I'm going to borrow a pillow, okay? And what you can do is whenever you feel like the urge to cough, you can actually hold on to this guy here, right? Wrap your arms around the pillow, and then you can cough. And that'll kind of help with the pain, okay?
Why does he need to do that? Because, I mean, it hurts him.
I know, it really does hurt, but what we're trying to do is we're trying to expand the lungs to prevent lung collapse. So what that does is when he coughs and he deep breathes, he's expanding that lungs to prevent the collapse of the lung. That's what we really want to work at. So that's one area that we can work to help with the pain. I'll go ahead and put this guy back behind you.
Well, I don't know. Do you think we can get you to do do something like that?
Maybe.
Yeah, and you know what? As a incentive too, I mean, we can also use your Pokemon cards. You like Pokemon, right?
Yeah.
Maybe how about that? Because usually what we like to do is we like to have him cough and deep breathe 1 to 2 times every hour.
Okay.
1 to 2 times every 2 hours, I believe.
Okay.
Yeah, to help with that as well. So if we have an incentive, we have the Pokemon cards. Anytime you do a coughing exercise, I'll give you a Pokemon card. How about that? Because I know you like to collect those, right?
Yep.
That'd be
Awesome.
cool. Yeah.
And then the last order of business, I guess, would be ambulating, because the nurse said that he's been kind of staying in the bed, huh?
Yeah, but I think he's fine laying in bed. I mean, I'm taking care of him. Anything he needs, I usually get up and get for him.
Yeah.
And he doesn't really need to get out of bed. I mean,
Oh, well, what we like to do, especially after surgery, is we like to have him getting up and ambulating. The ambulating helps with several different things. For instance, it helps with bowel movement. You know, we are giving him pain meds, and one of the side effects of the pain meds is constipation. So getting up and ambulating helps with the constipation, and it also helps with blood clots too in the legs. You know, when we get him up and moving, we're helping that the legs perfuse, so we don't actually have any kind of deep vein thrombosis. So
it's kind of hard to get him. I mean, I know the doctor mentioned it,
Right.
and he said he was tired, so I was okay with him just kind of laying in bed because he says he's tired.
Yeah, and I understand, but you know what? We always like to have a good time. I mean, I know that being in the hospital is no one's great time, but what we can do is we have a game room that's actually down the hallway. You like to play games, right, Cam?
Yeah.
Do you like to play Xbox?
Yeah.
Like to play card games,
Yeah.
board games? Well, there's tons of stuff down there in the game room. Maybe we can go get you up and walk in, and we can maybe do a couple of laps and then head to the game room so you can
Okay.
get out of the room and play. Does that sound like a good time?
Yeah.
Okay, awesome.
You think you'd like that?
Yeah.
Yeah?
I'm sure you would.
Okay.
So you want to go with the nurse right now to go to the
Yeah.
game room?
Yeah.
Okay, awesome.
Good
All right,
play?
well, here, let's go.
Okay.
Awesome.
Did I have with this thing?
You
Okay.
have, of course, you have to wear your gown.
It's so weird. What is this? Is
Well, I know, but it's a hospital gown. You have to wear that in the hospital.
This is like 15 sizes too big. Ow.
Come on, yeah. Hi, guys.
Hi.
Hi, well, today's the day, Yam. You get to go home.
Yay.
Are we excited about this or
Yeah.
what?
Your family.
Oh, I know, I bet. So the last thing I wanted to kind of go over with you guys before you go, because I know you guys are anxious to get out of here, I'm sure, is just a couple of things. Like I know Gam said that he is involved in sports. Like he told me he plays soccer and football.
Oh yeah.
So we just want to make sure that, for especially kids during his age going out and playing, just make sure that he's got his safety, taken care of. So his helmet is definite must, and also like the padding as well too. So make sure that you stay protected with those two things. Make sure that he's taken care of with his diet and his exercise. I mean, I know you, Gam, you love to go out and play with your friends all the time, so I think you got that pretty much taken care of.
Yeah.
How long does he have to wait before he can? Because he's dying to go home and.
Oh yeah.
Do his
And then
thing.
as I'm sure he is, he's been here for a couple of days. He's ready to get out, but we just want you to take it easy, okay, Gam? So
Okay.
like at least another 2 weeks, just have him just kind of slow down. Don't have him like going out running too much strenuous exercise is the point that we're trying to get across. So
Okay.
kind of take it easy for the next
Okay.
week or two.
Okay, that
Yeah.
sounds good. Say thank you.
Thank you.
Oh, thanks,
Thank
guys.
you so much. I appreciate all
No,
your
you're
help.
absolutely welcome. You guys take care. If you need
Thank
anything,
you.
just let me know. Okay.
Okay, great.
Awesome.
Thanks.
Thanks.
Goodbye.
Bye.
Bye, guys.
Project. First, we looked at the Hispanic culture. In Hispanic culture, children are often taught to respect their parents, and mothers are typically the primary caregivers, and that means that they a lot of times are teaching their children. Because the father is the primary breadwinner, he's a lot of times out of the home and doesn't have quite as much of a role in that aspect. So whenever we're looking at our 10-year-old in our project, if his mother says, Johnny, I need you to get rest, stay in bed, and the nurse and I will wait on you hand and foot, and then the nurse is saying we need to encourage the child to get up and ambulate, we see that they're both at odds. And if that's the case, the mother's going to win. because the child's going to resist the urge to ambulate, probably due to the pain, but also because mom's encouraging that behavior. And if we look at our two theorists, Erickson and Kohlberg, we can kind of see how that plays into this. The psychosocial with Erickson talks about industry versus inferiority. And one of the things that we kind of focused in on was that they want to be part of activities that they can carry through to completion, giving him things that can kind of direct his energy so that he can find a little bit of fulfillment in that with the psychosocial. And then Kohlberg's moral development in the conventional stage, or also called good boy, nice girl. The children at that age typically cooperate with authority figures. In this instance would be more on the mother's side. And then they obey rules typically, but that can kind of be dictated by the mother or the nurse if the mother is getting involved in that. So that's kind of our developmental aspects we looked at. But then the nursing interventions that we gave, the first one, the primary one we really want to focus on is education. We want to educate the mother so that she understands the reasons for the treatment. And if she understands the reasons, she's a lot more apt to go and be on board and buy into that and contribute to helping the child to see the importance of it. And then that would give direction for the child so that they can follow that authority figure being the mother, but then also having the medical staff that was contributing to that. And then we wanted to keep the child preoccupied, give a little bit of direction for his energy. One, by giving him Xbox in the game room, that would allow him to ambulate to get there, increasing his getting up and walking the halls. And then his card collection kind of gives him a little bit of distraction too, a little healthy distraction there. Our anticipatory guidance, we want to make sure he has safety in sports because he likes sports. He's also involved in football, so we want to make sure that he stays safe in that. And then regular exercise and a healthy diet are things that we wanted to keep in mind whenever giving the anticipatory guidance for a 10-year-old. So that's it. That's our project. Hope you enjoyed it.